I've loved it, but I've loved it in part because the sessions I've been to have been really stimulating. But probably for me, the biggest factor is the number of people who've been giving me feedback about how much it's meant to me, and how much they're learning from it, and how much stimulation. Because that was ultimately the reason for doing it. It was a belief that the analyst community has got a fantastic thing to contribute, but that many analysts are isolated, and there wasn't an extant forum for analysts to come together, share their work, borrow from each other, motivated by each other. So that's why we did it. So when I get that kind of feedback, that makes me happy, because it means we're achieving our original objective. It's a bit invidious to pick that, but I found some of the personal stories. I did find Anita's story of her career actually very inspiring and unexpectedly so. And I think she's made some very important contributions to her career. So to hear how she how almost the accidents that led to her giving the role she did was real food for thought, actually. I've also been struck. We've had a number of presentations about the explosion of linked data repositories for research, and I think I'd got slightly out of. I was slightly out of touch with the pace at which they're moving, so I was very struck yesterday and today about the enormous opportunity that they now represent for analysts and images, because it seems like we're right on the cusp of becoming a generally accessible tools for health services. But we're only going to do that analysis if the people who make the decisions about what's important decide that analysis is important, and don't spend 90% of analysts' time doing performance reporting, which is what we do at the moment. And given that the new government's announced that the NHS is broken, I think you can fairly clearly point to the obvious assertion that performance management doesn't achieve very much then, does it? So why don't we do less of it and get our analysts working on performance? If I get a bit grandiose in my vision of a hacker, but you know, you don't go on through life if you don't have some kind of dreams for it. So I think hacker could become a movement. I know that there are some extant national arrangements, but they have different characteristics to hacker. So hacker is by health and care analysts for health and care analysts. It's a commercial free zone. It sets its objectives to be about raising standards and bringing high quality work to people. And it's clear there's a community that wants to engage in that. You know, I don't know what the final count is, but something north of 1,200 people, analysts, participated in this hacker. Again, views vary about how many such analysts there are across health and care. If you looked at the Institute of Government report recently, they pitched it at about 6,000. I've seen people suggesting there may be 12,000. But whichever one it is, we've had somewhere between 10-20% of the analyst community in health and care touching hacker. So I'd like to introduce some things that keep that relationship going through the year, so that the conference becomes a culminating point for a set of other activities. And I'd like to see those activities kind of be a kind of series of opportunities for people to engage, in online things, of course, but you know, I don't see why we can't do training, workshops, seminars, communities of practice. I think we could do all those things, but we need the analysts to ask, because we do need to find some way of getting the solutions to support that. And the best way to make the case for the resource is the analysts shouting loudly that we want this, and having this will help us add value. But that's what I'd like to do. I'd like hacker to become a focal point for the entire as a community and something. As I say, the conference then being a big annual convention that is that